Affordable healthcare is the subject that you asked me to share some thoughts about, and I just walked in and noticed the chart that you had up there about affordable, accessible, fair, equitable access to finance was what the microfinance industry is expected to deliver, and that you have played, I know your organization's played, a very substantial role in providing some muscle, some catalysts to that change and ideas. And I want to talk to you about the ideas that are necessary to shape affordable healthcare in our country, in India, and perhaps also these might help in enabling more affordable healthcare elsewhere in the world. In India, the next frontier for innovation is healthcare. It's the country with, if I can say, the greatest unfulfilled requirement of healthcare in the world. And therefore it is the greatest opportunity for finding new solutions to and new markets for this requirement. Why is it that it is the greatest unfulfilled market in the world, healthcare in India, is because the presently available solutions and systems are not meeting the needs. And therefore we need new solutions. The presently available solutions and needs are ideas that we have borrowed from elsewhere, ideas that we have invented ourselves, and that we are persisting with, believing that merely better execution of these ideas would be the solution. And of course, we are very poor at executing things also, so maybe it is that better execution of known ideas is the solution. But I want to point out that actually we need very different ideas than the ones that are believed to be, by some, the solutions to affordable healthcare or healthcare in the country. The health market as a market is different to the market for automobiles and the market for cell phones. And we have succeeded quite well in providing people in this country with affordable cell phones and accessible communications through cell phones. We have also succeeded in our country to provide people with more affordable two-wheelers, motorcycles, and auto industry is going very well too. And so we can be quite satisfied to say we know how to develop producers and distributors that can make things available to people in this country that are affordable and accessible too. But I want to share with you, remind you of a cartoon that Mr. Lakshman, R.K. Lakshman, who is the original Aam Aadmi, and to our foreign guests, Aam Aadmi means the common man, which our political parties keep saying is their constituency and to whom they direct their schemes and their ideas. And Lakshman is the original Aam Aadmi, and his cartoons since the 1950s have always had a little Aam Aadmi commenting or observing with wonder things happening around. And in this cartoon, there is a group of people who are confronting a minister who has arrived in his helicopter there, and he's driving up. And they are all looking quite angrily at this person, this minister. And he's saying quite angrily, when we have given you cell phones, why do you keep asking for clean water? So there are things which are needs, basic needs, and there are things which are desires, and they do improve life, those desires, but they're not as fundamental for life as is clean water or as is good health care. And so therefore, to remember this is extremely important when one thinks of transporting solutions that have worked in how we've gone about, let's say, as people say, getting the government out of the way, and therefore we have cell phones. And therefore we should, even in healthcare, get the government out of the way, and we somehow is going to get good healthcare or clean water. The difference between markets for automobiles and cell phones and healthcare, and I would say somewhere in that continuum in between is education, is that in markets for automobiles, and perhaps even cell phones, if a person doesn't have the automobile or a cell phone, the person can still live a pretty good life, actually. And some say that might live a better life without a cell phone disturbing us all the time. But without good health, one cannot live a life at all, perhaps, also. So if we believe that every human being has an equal right to life and to some very basic things like clean water, then the fact that they are too poor to afford it shouldn't come in the way of the provisioning of it. Whereas private sector is geared towards efficiency by, of course, taking cost out of things, but also by ensuring that it delivers only to those who will pay what, at that point of development of efficiency in the system, the private sector can afford to deliver. And so, if you can't afford a BMW car today, that's okay. You're not entitled to have one. But if you cannot afford good, affordable health care, we believe it's a right. You're entitled to it also. And the private sector is not geared to address this question of equity, that in fairness, even those who cannot afford should be my customers. And how do you find that model, that solution, which will include those who cannot afford as your good customers too? And so we come to the need for democratic governments, especially democratic governments, to intercede, because democratic governments all over are recognizing that the poor, if I can use Mitt Romney's, the 47%, matter a lot. And you've got to take care of their requirements too, and not just the requirements of those who apparently can afford to pay taxes and sometimes don't. So it's not about the voices of the rich, it's also the needs of the very poor that have to be met by governments. And so we come to government. What should be government's role in healthcare provisions? I would just very simplistically, and you people would know much more, and I'm sure in the course of the day, you will get down to where are the opportunities to improve the system, and I'd love to hear at the end of the day what the ideas are. Well, one is three levels, I said. The one level is that provide people the money with which they can buy. If the point, as I said, is they don't have the money to buy, whether it's automobile, cell phone, or healthcare, give them the money to buy it. And that could be through insurance also. So schemes which will enable people to get money in hand or through insurance to pay for healthcare is good, and we need innovations and ideas in that regard. And cash transfers, which as you'll be seeing nowadays, is the big thing in India, is cash transfers. It's a way of getting money in the hands of people so that they can then buy what otherwise they could not afford. Well, if you're sitting in some remote place in Jharkhand and you are given cash in hand and expected to take care of your health, how are you going to do it? You need to have the provision, the supply side of education, of health, of sanitation services, and so on. So merely transferring cash into the hands of somebody is not going to enable them to get the outcome that you hope they can have in their lives, that is good health, unless you fix the supply system too. And so we come to the two other domains of the system, one being the delivery system. How do you ensure that the healthcare providers and also the facilities for healthcare provision are accessible and they are acceptable in terms of the quality of what they provide, and of course affordable. So the innovations required in the distribution systems, in the provisioning systems, are the key, perhaps, and not getting the cash in hand only. The third area for innovations is the production of the medicines or devices, I'm not talking particularly healthcare, that should be used and available through this distribution and provisioning system. And this includes, of course, we've got a big debate in our country right now about the prices of medicines and generics versus more branded, so-called innovative medicines, which cost a lot, patented medicines. what should be produced and how should it be produced and how should it be priced is on the production side questions for medicines, and so too on something that I know you wish to focus on today is on the medtech, or the instruments and devices that enable medical professionals to understand a patient's needs and also deliver to those needs. So here too, what are the best ways to produce what is required, to first design and then produce what is required and then make it available. So on the production side also of medicines and devices, there's a need for innovations and new solutions. As you come to in your network today, you are thinking about, I'm sure, innovations in the whole system. So very simplistically saying, we need definitely innovations in and entrepreneurs with regard to the production and sale of medicines as well as medtech devices. We also need innovators and entrepreneurs developing new ways to organize the delivery of healthcare. And perhaps we also need innovative ways to provide money and insurance, which may be similar to what you're talking in microfinance. It's in the financial space. How do you do that too? So, okay, the private sector can find the solutions in all three areas. And in the US, we say we have an innovative drug production industry, the biggest innovative. I claim to be the most, but I challenge that and say that industry is not finding solutions for the needs of people who don't today have the money to pay for it. And by insisting that since innovation is expensive and you need to recover it and therefore you need a monopoly time, a period for it, you are already excluding those who can't afford to pay because they can't afford to pay the cost of your expensive innovations. And so we are getting a greater discovery and sale of lifestyle medicines. They do very well for the companies, but too little development and discovery of treatments for diseases and conditions that affect the poorest people of the world, not from that innovative industry. So we need other innovations about the industry itself, the process of innovation and the construction of business models in the production of medicines and meditech devices that will answer the needs of the poorest and provide solutions in a more equitable fashion. For medtech, India is a good place to produce, I believe. We have a rather large source of skillable people, some skilled, but many more available who are skillable people. We do have ability to engineer things innovatively, and that's being discovered, and many even international companies are here in the country using Indians in their centers to innovate things. And that India's got a very special place with respect to design and innovation of technical devices was brought out very clearly the day before yesterday when the Indian International Semiconductor Association made a presentation to us in the Planning Commission, and they showed a map of the supply chain of electronic stuff. And they said, well, you've got one domain in which you design things and invent things and so on. And then you have the other end, the actual use of electronic devices, and there are thousands of different users and devices. They go into automobiles and they go into white goods and so on and so forth. And you have, before that, the production of these devices using the designs. And what they pointed out was that there's almost no device, electronic device in the world today that does not have something that has been designed or patented in India. Not done by an Indian company, done mostly by international companies, but done by Indians in India. And so we have the situation, they pointed out, that the growth of demand for electronic goods is going to be in the next few years, it already is, and going to continue in the next few years to be the highest in India compared to any country in the world. So we have a situation where the demand is there, the need is there, and the knowledge and abilities are there to design them, but the production is not there. So we come to the medtech industry too. The possibility of creating the manufacturing also in the country is there. But then when you come to what is required to induce the manufacturing, two things come. One is, well, just the basic infrastructure to enable the setting up of manufacturing units which are not hassled by poor infrastructure and by government regulations needlessly, inspections and so on. But you do need some regulations too. And so as has been pointed out in a paper which you gave me, that the regulation of the producers is absolutely essential. And it's essential for two reasons. We are talking here about health, and we cannot allow, whether it's medicines or medical devices, things which are not, if I can call it, acceptable to be sold. They could be affordable and they could be accessible, but they need to be acceptable to be sold. And for this, we need to have an imposition of standards, and if people will not voluntarily subscribe to those standards, the standards, then someone has to, on behalf of the people, regulate and impose those standards on all. And this helps, of course, those who are producing the good stuff, that they are in fair competition, if I can say, and are not having their market taken away unfairly by people who are selling false stuff, bad stuff. And this happens in medicines, it will happen, it is happening in the medtech also. So government will have a role and should have a role to play. The second is there is potentially large demand, but to start accelerating, and this was your point about acceleration, accelerating the demand, you need to early on aggregate in some ways and offer that as to say, this is what I will buy, a large number, and then you have an incentive to produce. And of course, your organization, the Gates Foundation, others are doing this in the healthcare. It's really aggregating a large amount and saying it's a challenge. Well, you can have it provided you meet this specification and this cost. And so government can have a large role in aggregating demand for medicines and for medtech devices. And with aggregation goes, of course, the standard. To what standard will you buy this? And there would be then a debate between the producers and the government about what should be the standard. And in that debate, of course, there's lobbying and so on. And we notice this in the car industry right now about what should be the emission standards. And those who can meet them say, this should be the standard. And those who cannot at the moment meet them give you all other reasons why that would be bad for general demand and so on and so forth. It would, in fact, curb overall the industry, they so say. And so these discussions would have to take place between variety of producers and government to come to what is fair and best for society as a whole. And in that regard, I come to now innovations in models of collaboration between stakeholders. We have adopted the idea of public-private partnerships, and you have mentioned that Jasjeet in your paper also, that, yes, that's the way to go. And in the form of the public-private partnership, there needs to be this question of equity and fairness, and not merely ensuring efficient gains to the private sector. And to do that, not just in healthcare, I would say, but especially in healthcare, but also in education, also in urban infrastructure, people need to be a partner in the devising of those models and the solutions. So it's not just public-private, it is people, public-private solutions and models. So innovations in that regard also. So here are 4 domains for innovation. One is regarding the payment and insurance systems to get cash in the hand for people to pay for healthcare. The second is in the delivery systems to ensure that the reach of these systems touches the people who need, and it's acceptable, affordable. And the third is the production of stuff, medicines, and devices. And the fourth is, as I said, the collaborative models, collaboration models between the private sector entrepreneurs, the government, and people organizations, and this includes civil society organizations. We in the country need innovation in the 4th domain, I believe most of all. If we can develop much better models of collaborative understanding of the needs of the various stakeholders, including the private sector producers, and of course the people centrally, as also the need of the government to be a sensible regulator and to accept that they have a role in this. So I come back to Lakshman and the cell phone and clean water to say that, let's dismiss government and we'll solve the problem of the world, I think is being rather simplistic. And so we need the government also as a partner and to recognize that they have a challenge too. And they like to do their job well. And so let's work together to see what each of our roles is and devise a process of continuing to learn together, because we won't get it in an innovation right the first time. It's not something you design and then put it into a standard model which is legally enforceable. Things will change, as innovators and entrepreneurs know, and they change because you discover new questions which you didn't know you would have to answer. And so we'll get feedback, it's not working exactly as intended, so what shall we do together to improve the collaborative model that we have here, and thus come out with the new ideas that will help to change the world of healthcare. So I say India is the next frontier for innovation, and I believe it through this process, which you shall hopefully provide a catalyst for, with some substance and money also to it, will produce ideas which are very good for the 1.2 billion people of this country and more, and hopefully will be providing some assistance to solutions elsewhere. And in that we recognize that there are solutions which are ahead of us in Africa, in Southeast Asia, in Latin America, and we'd like to pick up those ideas too for the sake of improving the lives of our people here in India. And there too, the people who are here in the room and yourself and your network could help to create goodness for us all. So thank you very much.